Good afternoon. My name is Dr. James Miller. I am a family physician here at Butler. I'm also the Director of Emergency Services and the Director of the Family Care Clinics here in Butler. I want to thank you today for checking in with our posts and later today with our question and answering session regarding the coronavirus and the outbreak. I thought it was important today to kind of get you up to speed where we're at with this infection and how it's affecting our community. As of today, we have 782 cases of COVID in our community since March. Of those 782 cases, we've had 11 deaths, and unfortunately more coming recently and in the months to come. We have 38 active cases currently in Bates County. These are cases of people that are hospitalized in Kansas City or at home on isolation. Our percentage of positive rate at Bates County Memorial Hospital and clinics is at 23%. The state average is roughly 15 to 18%. Adjusted for population tells us we've got a heck of an infection going on in our community. My thoughts were, what can I do to help the community understand where we're at with this infection? Our question and answer session later today will help with those questions. But also I thought I could kind of relay my thoughts on this issue. I see three things in our community that we can do together to put a stop to this disease. The first thing we can do is wear a mask. I'm currently in a room with nobody else but some people helping me with this video. But I wear this mask religiously every day, to and from the office, and of course when we see patients. The question is, why is this important? This mask protects not only you, but it protects me. If I had the infection and I sneezed into a room where you were at, if I had this mask on, it would prevent you and lower the chance of you getting an infection. So this is really important. The second thing that I view that is extremely important in controlling this infection is social distancing. And we all know what that means. It's a difficult topic, but it would be that we avoid being with groups of more than 10 people if we can. If we're going to have activities such as basketball games or other activities where around a lot of people, we should wear a mask and we should social distance. Get away from people more than 6 feet. The reason is that if somebody's infected in that room or in that auditorium or that gym and they cough, they can infect a lot of people. The final point that I would bring up about the protection of this disease is vaccination. Now, this is a topic that I'm not going to be able to convince each and every one of you to get vaccinated, but it's my goal to let you know how I and many other people feel about this. We will have questions today in our question and answering session to answer this in great detail, so I won't go into that here today. But it's without question that vaccination is going to get us out of this scourge. It is safe, it is effective, and it will help us. I believe in this so much that I'll be one of the first healthcare professionals at this hospital to get vaccinated. If I didn't believe it was safe, I wouldn't do it. And finally, I want to say thank you to the healthcare professionals at this hospital. Each and every day, my nurses, my staff, all of us come in here taking a risk. That's a risk that we signed up to do. Taking care of our public is our number one priority, and we're going to do that to the best of our ability. How can you, the public, help us? Listen to what we say today, take it in, make decisions that's based on science, not hate. Make decisions on the right thing to do to protect not only your family, the community, but for all of us. Again, thank you for tuning in today, and I look forward to your questions.